Hi everybody, my name's Anita Sangera and I'm an advanced pharmacist at the QE hospital as well. I've worked in gastroenterology for about 15 years with a special interest in intestinal failure and nutrition. Today the aim of my talk is to talk to you about why your anatomy changes how drugs work, what common things you should look out for different medications, how to manage some symptoms and how to manage costs. So what is the gut? So it's a large organ. It helps to break down your food so that you can absorb the nutrients that your body needs to function. It can be in varying lengths, up to 9 meters long, and it has about 800 to 900 folds. This maximizes the large surface area in the bowel, which helps absorption. If it was laid out flat, it could cover an entire tennis field. It's made up of the large and small intestines. The small intestine is where most drug absorption occurs, and the large intestine is where most fluid is absorbed. So with a pouch, your anatomy is altered and your gut is altered, and it's very unique. The pouch procedure allows patients to avoid having an external collection waste bag or a stoma. It can be done in stages or a single procedure, and there's the removal of the colon and the rectum, and then the ileum, or a part of the small bowel, is connected to the anus. So what does this actually mean? What does this altered anatomy mean for absorption of food and medication? It means that you've got a shorter surface area, and actually food and drugs pass through much quicker. So when I was at university, we learned about pharmacokinetics. This is the movement of medication through the body. So all medication that's taken is aiming for a different type of receptor. But in order to get to that receptor, it has to be liberated from the medication form that's provided. And when I was at university, we learned of LADME, which is liberation, absorption, distribution, metabolism, and elimination. So the two factors that affect you the most would be liberation and absorption. The drug can't be broken down effectively, so it can't be liberated, and then absorption is difficult. So what could we do better? Healthcare professionals can try and help you. They can monitor your clinical outcomes when you're taking different medications, and then they can alter those medications, either providing longer durations of treatment, or they could provide a higher dose. Otherwise, they could choose a different route as well. You could maybe have a patch or an injection. With our stoma patients, sometimes I'll tell them, have a look in your stoma bag. Has the medication come out whole? That would indicate that it hasn't even absorbed. It hasn't even been broken down to liberate the medication in the first place. But I think for a person with a pouch, that's probably tricky. So we could monitor the stools, but that's probably going to be tricky. So there's lots of different medication forms available. And you might have heard of CR and SR kind of preparations. These preparations are cleverly altered and designed so they release their medication along the bowel. A lot of the CR preparations are actually designed to release medication in the colon, but pouch patients don't have a colon, so actually they're not going to be effective. They're likely to just pass straight through. So we could think about using liquids or soluble tablets because the liberation already occurs, and so they might be more effective. So you need to, as a patient group, you need to ensure that you tell anybody who prescribes your medication that you've got a pouch, and it might mean that how your body manages medication might be different. I had a patient who had back complaint, and he was saying that the medication he was given just wasn't effective for the back pain. Like, I'm not a pain specialist, but when I looked at his medication, it was a CR preparation for the pain. So actually we decided to change that to a liquid preparation and give it more frequently, and that really did help to resolve his pain issues, which were really, sorry.
What do those stand for, the EC, the SR?
So EC is enteric coated, SR is low release, and yeah, CR is controlled release. Is that okay? Thank you. Also, another thing to bear in mind is liquids can be really useful options, but with liquids, sometimes they contain lots of artificial sweetener, and actually too much artificial sweetener can drive diarrhea as well. So it's probably sometimes not a good option. Has your bowel frequency recently changed? Have you decided to change what you're eating and eaten something that's upset your stomach? Have you taken medication that can alter your bowel frequency, such as antibiotics or laxatives? Are you still taking your loperamide and codeine? Have you recently travelled abroad, or are you feeling unwell? These are all things to think about if your bowel habits change. Could it be pouchitis? Sorry, I went a bit quick there, but those are symptoms for pouchitis. So pouchitis can be managed quite effectively with antibiotics. Undertaking the antibiotics correctly is really important. I've had patients before who have been on a course of treatment for their pouch, taken a couple of days, and then actually they've come back in with a relapse, and it's because they haven't completed the course. When I've spoken to them, they've still had 2 days left. They were feeling better, so they decided not to complete the course. I think that's an example of why it's really important to take the whole course. And there is an antibiotic awareness campaign. It's trying to ensure that antibiotics are used in the best way. It's to avoid antimicrobial resistance, and it's to avoid relapses. So it's really in everybody's favour to do that. I thought I'd mention probiotics. The jury's still out whether probiotics are helpful. They contain varying strains of live bacteria. There's not a lot of evidence that they're effective, and they're no longer available on prescription because they're seen as a food group. So what I would say is they're still available at pharmacies and health food groups, so it's worth trialling them. And actually, if you find them effective for you, then it's a good choice of option for yourself. You may have been advised to take loperamide and codeine, and these can help to reduce the amount of times you need to go to the bathroom, or the quantity. These medications actually slow your bowel down, so they act inside the gut to increase the time you have for absorption, slowing things down through the bowel. And they both work very effectively together. It's worth mentioning to your healthcare provider that if you're on codeine, that it's not for pain. I've had situations where patients have come in and they've got watery diarrhea, and it's because a well-meaning healthcare professional stopped their codeine, because, of course, codeine is seen as an opiate, is seen as a drug of dependence. But actually, for your altered anatomy, it's actually important that you take it with your loperamide. Also, because they work by slowing your gut down, you need to take it about 30 to 60 minutes before you eat. Otherwise, it's just not as effective. Another point to note is the box might say do not exceed 16 milligrams in 24 hours. However, this isn't relevant for your condition. You can take as much as you're prescribed, or as much as you need for your movements. Then I thought I'd talk to you about B12 deficiency. So one of the consultants I work with explained to me how B12 is absorbed in the body. So it's the use of an intrinsic factor from your stomach, and it's absorbed in your terminal ileum. Of course, your terminal ileum has been used to form your pouch now, and the body's actually very clever and will adapt. So your terminal ileum the lining starts to become kind of like the colon. So actually, it might mean that you end up with a B12 deficiency. And it's really tricky, actually, to measure B12. The blood assays we have aren't always very effective. So what I'd say is that you actually need to look out for symptoms of B12 deficiency. There's lots of reasons you can have a deficiency. First of all, your altered anatomy. It can be dependent on your diet, especially if you're vegetarian or a vegan, because you just won't have as much B12 available to you, so you'd need to have a supplement for that for sure. It can be down to different medication. So if you take medication for diabetes, such as metformin, that can affect B12. Or if you take a PPI, such as omeprazole or pantoprazole or lansoprazole, all of those can affect B12 absorption as well. So it might be worth talking about having a supplement. I've had a patient before who told me that she was feeling a bit run down. She's having kind of numbness in her finger. She had a bit of mouth ulcers. She put it down to just aging and being perimenopausal like myself. But actually, when we saw her in clinic and did her bloods, her B12 was low. So she's probably manifesting signs of deficiency. So we promptly treated the B12. Then I thought I'd move on to vitamin D. So vitamin D is normally absorbed in your jejunum and terminal ileum, again, we talked about the ileum being part of your pouch now, and it will probably adapt and change. It's facilitated by consuming fatty foods. So if you have something fatty when you're taking a supplement, or if you just eat different foods that contain vitamin D, some of the pictures there indicate some of the different ones. That will probably help to facilitate. So causes of a deficiency can be that your diet's not having enough. It can be different medications. And again, for yourselves, it's anatomy. But vitamin D-rich foods would be oily fish, salmon, sardines, herrings, mackerel, and things like that. And eggs are quite a good source as well. And again, those are a few symptoms of vitamin D deficiency. For iron, iron can irritate the gut. It's notorious for doing it. However, what I would say is there's lots and lots of different varieties of iron out there. They're made of different salts. There's liquid preparations. So it might be worth trying a few out to see if one suits you. It can make your stools change colour, appear darkened or black. And if you get leaks, it can be quite sore. Intravenous iron is an option if you speak to your healthcare professional. But then you have to attend a clinic to go and have that infusion suites. In order to stay hydrated, you may have been provided with information about oral rehydration solutions. There's lots of different ones available, but it needs to be a specific concentration to activate the glucose and sodium pumps in your gut to allow your small bowel to actually absorb more fluid. There has been shortages of some of the ingredients that are available. So, for example, to make up things like St. Mark's. So the examples that I've shown you here are ORS tablets, St. Mark's solution, which is made up of salt, sodium bicarbonate, and glucose powder and diaurolite. There was a shortage of things like glucose powder. So I had patients who'd come in to our clinics who reported having more watery stools. And it's because when there was a shortage of glucose powder, they used just normal sugar. But of course, normal sugar isn't actually made up of glucose. So actually, it meant that the St. Mark's didn't have the right concentration, so it wasn't working as effectively. So once we kind of reached that conclusion, we sourced other items that you could use, such as the ORS and diaurolite. But something to mention about those is those products were formulated for traveller's diarrhea, and that's diarrhea of the colon. So from the colon, you actually lose lots of potassium. So these products actually contain a lot of potassium, so you have to really be a bit more careful, and actually having your potassium levels checked if you're on either of those products is really important. And these are some of the ways that you can make ORS taste a bit more pleasant, because it isn't the nicest thing to drink. Another thing to mention is if you do use squash or anything to sweeten the ORS or make it taste more palatable, you should probably use squash that it hasn't got artificial sweetness, because artificial sweetness, too much of it, will drive diarrhea again. Even some of the sports drinks that claim to be electrolyte rich, we've had patients who have tried those, and it's just exacerbated stoma losses or diarrhea, because they, again, contain lots of sweeteners and they don't have the right concentrations. And I would advise, whatever you put into the, say if you're making a litre of St. Mark's, whatever you're putting into it, put your ingredients at the bottom first, any flavours or squash or anything, and then make up the solution so that the concentration is correct. Lots of patients with pouches suffer from bloating and gas. There's medication that you can use to kind of help to improve that. You can step these medications up and down depending on your symptoms. So there's peppermint oil, water, and there's capsules that are available. There's also peppermint tea that you might find soothing. If you take them about 30 minutes before food, because they actually help by relaxing the gut and help to pass the wind. Then there's simethicone. I used Infocol for my babies when they were little, and it really was effective to help them belch up any gas that was trapped. Adults can use it as well. So simethicone is a licensed medication. It works by binding to the bubbles of gas and allowing them to be expelled either as a burp or as flatulence. Both of these things can be bought over the counter. There's Infocol or Windy's capsules that contain simethicone, but costs can build up really quite quickly for patients. So actually, that's why I thought we'd move on to that a little bit further in my talk, because then what's available to you over the counter, it's only going to be in small quantities, and then, you know, it can just build up. So for pain relief, there's lots of different meds out there. So paracetamol is very effective. It can be available as a liquid or dispersible tablets or suppositories. Then you've got your opioids, such as morphine or codeine. You're probably already going to be on codeine, and actually using 2 opioids isn't always a good choice because it can increase the side effects of opioids, such as drowsiness. But you might find that the constipating effect of opioids might help to thicken up your output or reduce the amount of diarrhea you might have. Then you've got NSAIDs such as ibuprofen and naproxen that are available quite easily as well. But I'd avoid those in a pouch because they can cause ulceration and bleeding of a pouch. But if you had like local pain, either say in your knee or in your shoulder, you could use the ibuprofen or diclofenac gel. So they're both NSAIDs, but because they're acting locally, they're not going to have the side effects on the gut. So just a bit about prescription charges. From the 1st of April, prescriptions went up to £9.90 per item. It's worth thinking about whether you're exempt. So these are just some of the reasons why patients might be exempt, and it might be worth getting a medical exemption certificate if you're eligible. Otherwise, if you're on more than 4 items a month, it's worth getting a prepayment certificate. So this is just some of the details of the pricing of those. And then I thought it'd be good to provide some signposting. So if you needed more information about medication, there's often patient information leaflets with the medication. You could ask your clinical team, your GP, gastroenterologist, stoma nurse, dietitian, your hospital pharmacist. Also, it's worth talking about reliable websites. Not all the information available on the internet is reliable. Some of it's just totally nonsense and is probably really terrible. So the internet's a great source of information and it's freely available to everybody, but not all the information out there is very good. So it's worth going to reliable websites. Then also speaking to your pharmacist would be a good choice as well. Okay, thank you very much.